That's my estimate.
Are they selling legally? That is, are they selling to people who have their registry cards, or is there funny business going on behind them? And if they're selling to people who don't have their card, aren't they breaking the law?
They are, and I don't think there's much abuse, to be honest with you. I mean, let's be real here. The recreational market right now in Colorado, the recreational market for marijuana dwarfs the medical marijuana market by many orders of magnitude. There's a population of probably 1 million people in Colorado who use marijuana on a fairly regular basis.
You think a fifth of Colorado?
I think so.
5 million people here. You think a fifth of Colorado uses recreational pot?
I think so. I'm not talking about.
I'm not talking about your friends. I'm talking about the real world.
I'm not saying every week or even every month, but once or twice a year. I think it's very common. It's all over the state. So that dwarfs the medical market. But the medical market is legitimate. It's helping sick people who are suffering. The advocates of medical marijuana are smart. They cherry-picked the most politically palatable aspect of marijuana, namely the medical use of it. There are many other benefits to it, but the medical use of it is a great benefit. Voters support that right now. This is baby steps towards a larger goal someday.
But will you concede that the current system, that there's abuse, that there are people out there who are buying medical marijuana for recreational use, which the law never intended?
I'm not sure, because I think in a democracy, our first objective is to trust the people. That's the point of this. That's the point of our system. And if a patient says he wants medical marijuana, and if a doctor agrees with that patient, and a physician who's licensed and who has been to medical school and who's trained and who's examined that patient says this patient needs it, and this is the gatekeeping function that the voters built into the law, is the physician. If the physician says
only a physician can put somebody on the registry, is that right?
Currently.
An actual MD. You have to be a doctor, not
MD
a nurse.
or DO, but we're hoping that expands at some point.
Let me answer that more bluntly and maybe a little more candidly than Rob did. Look, I don't think we know. Is there more or less abuse in medical marijuana than there are with prescription drugs, opiate, and OxyContin? I don't think you know the answer to that yet. I think that I know there's abuse of OxyContin. You can go look at the number of people who died on OxyContin in the United States last year. It's tremendous. And I get tons of emails, and one of the most impressive emails I get are people who've said, I was up to 4 to 8 OxyContin, I was putty on a couch, I had lost my life, and I started using medical marijuana, and I'm down to 1 or 0 OxyContin. Right. We're a healthier state when that happens. That said, I do think there is a risk, because the total unregulated nature of medical marijuana, the risk of abuse could be significant over time, which is why I just think putting a little bit more controls on a powerful psychotic control substance is why I argue for a little control.
Let me back this up and let me see if I hear what's going on. Here's a guy who's sympathetic to medical marijuana users who are using it for legitimate purposes. Here's a guy who has made his business bones on opening up this market, and you more than anybody else in the state have been in the trenches for 9 years. And now you've got to the point where we now have an open market. People can open up a store and sell something only to people who have been okayed by a doctor. So let me bring it over here. If these were ice cream stores, if these were yoga studios, if it was the fad of the month, what would happen is lots of businesses would open, and over time there'd be consolidation, there would be buying up of different things, there'd be franchises, and some would cater to the hippy-dippy guys who sit on crystals and smoke incense, and then some would be catering to people who want to see people in lab coats who are much more clinical. Why not give anarchy a chance? That's all I'm saying. Give anarchy a chance. Let's see what happens when this market shakes out over the course of the next few years. My guess is we're not going to have 300 retailers. I bet over time we're going to end up with a handful of big companies that take care of it. Why not just keep your hands off of it? I remember George Bush, of all people, said keep hands off the internet. In fact, I think it was Bill Clinton. And that helped the internet by not regulating it, by not taxing it. We now have a system where businesses are popping up and people are regulating it by their use. Why not just give freedom a chance on this one and let this business shake out on its own?
What's a little different, my argument,
Yeah,
for
where's
that.
the harm? That's the larger question.
Let's be careful about first where the issue, because I actually agree with you. I think my number is about 500,000. You're setting up probably I think this
500,000 what?
500,000 people who smoke recreationally. So you're setting up a controlled substance from municipal right next to
talking
you.
about different
I
circles.
can only tell what kind of friends you hang out with. 1 out of 5 for you and 1 out of 10 for you.
I live in his district, too, and he's a Democrat.
But let's be clear about this. You're setting up a system, and right now, I totally agree. The value of being legal, big surprise in America, is actually priced, and the price of being legal has a real premium, which is why all the arguments that actually the medical marijuana is going to slip out the back door is false, because it's actually being priced significantly higher than the recreational market.
Because people are willing to pay extra to be safe from prosecution.
Correct.
And the quality is better.
And frankly, people miss that a lot, and that's a really important economic argument. But I do think because it's a controlled substance, and it's a controlled substance pretty powerful, that there's an argument that you want to have some controls on it, and you shouldn't just let 1,000 flowers grow and let's see which ones live and which ones die. Because I think you, could end up with some bad players and bad apples.
We need more than 1,000 flowers in Colorado right now.
Well, I would disagree.
We need 1 million flowers to supply. You can't repeal the laws of supply and demand. And the demand is up here, and the supply is still down here. You're trying to repeal those these laws that are etched in stone, the laws of supply and demand. The only way to lower the price is to increase the supply.
But I think that's a long-term legalization argument, and I'm open to that debate. But as it relates to medical, I really think the voters had a certain intent, which was to have a compassionate vote for people with chronic illness.
Right.
And I want to live up to that vote, because I actually think that the Constitution means something contrary to what some of my colleagues in the legislature say. And I think it's in the Constitution. Therefore, we're to follow the intent of that vote. Where I disagree with the health department is, and also law enforcement, including Southers, who said to me, Romer, there were 2,000 people on this registry a year ago. There are only really 2,000 real patients. That's not true. There were 2,000 people who were willing to be on the registry before the president said, you're still a good American if you want more. I think there are going to be 50,000 people on that registry, and I think we got to set up a system to serve 50,000 people.
Let me push you on this. Why? Listen to me on this. All right, right now we have a system that in order to get on the registry, somebody who went to medical school needs to put you on it. If it's on there, who cares how many dispensaries there are? Who cares where they are in those towns and in those cities? They will go, and as competition happens, some of them will falter because some of them will have better service, so others will have better price, some of them will have better ambiance. And you know what? We're at the fledgling part of this business. Why in the world does government need to come in and start monkeying around with it? Give it 10 years. It's taken 10 years now to the point where a store can even open up.
Well, again, I'm willing to give it a little rope, just not as much rope as he's willing to do. His argument is I'm going to put so much tight on the rope, I'm going to hang it. That's not what I intend to do.
But this chokes it. This
I know you believe that
chokes
it. I disagree with you on that, Rob. But the issue is this is a controlled substance. There are some cases under which this has been contaminated with pesticides and molds, and so there has to be some quality checking over
which
time.
Your bill doesn't have no quality checking.
I agree, and it's a shortcoming because there's only so much I can get done. The other issue is like liquor, which is another substance we control. We set up a system that says, hey, we want to think through over time how many liquor stores we want and who sells liquor.
Yeah, and unfortunately, I'd say in Colorado we have one of the most back-ass liquor laws in the world, where you're only allowed one liquor store. You can't have distributors. It's a very odd system. I wonder what it would look like. And also with liquor, let's face it, we're trying to do behavior modification. That's why 40% of what you're paying when you buy a bottle of booze is sin taxes to try to discourage you. Let me bring it over here. All right, all we're looking for is some reasonable restrictions. In other words, I'm Ma and Pa, I'm used to life, and now I'm passing 4 or 5 pot shops on my way home at night. I'm thinking, wait a second, when did this happen? I don't mind people having medical marijuana, but when you see that a couple of doctors are responsible for, they say, 80% of the people on the registry, it gives me the impression that there are a lot of people having a good time and protecting themselves from prosecution that really don't deserve it. What's wrong with saying, listen, what we're going to do is we're going to reel it in a little bit. We're going to make sure that they happen in right places, that they have more oversight, so that it's done well. In the long run, doesn't that help medical marijuana?